This was my first case out of the chutes this morning. 19-year-old healthy male had symptomatic lower wisdom teeth where there was an oral communication with 17 and 32. You could see the crowns of the teeth through the soft tissue, trapping food, had a little bit of inflammation, pericarditis around those two teeth. Patient elected, after discussion with him, to remove the uppers at the same time in a preventive fashion. A couple points I want to make. Uppers, 1 and 16, when they delivered in an acute angle to the buccal. And when I saw this happening, one of the things that I try to prevent is tearing of the soft tissue flap. I traditionally do a mid-crustal incision over the tuberosity and come around to the first uh, distal of the first molar, reflect the papillae, and then I get a good envelope flap. But in this case, I had to go a little further to the mesial on this to make sure I had enough soft tissue laxity and the flap was free enough to deliver this thing without catching the tooth catching the flap and tearing it. It usually tears right here between the first and second molar on me when I push the limit and don't have a good passive flap. So that's one thing that I would like to point out. And that happened in 1 and 16 both. I was able to avoid that. I recognized it early and was able to just go ahead and advance my envelope flap to the mesial of the first molar to make sure that that didn't occur. It lay passively afterwards, and the patient did well with those. The 17 and 32 removals were a little bit more complex than I first imagined. The approach here, in my mind, was to do a vertical sectioning of the tooth with a 703 burr on a straight handpiece. Once I did that, section the crown from the roots, try to lift the crown out, and then remove the two roots independently in a horizontal fashion. And it was a little more challenging than I first thought because this lower half or mesial half of this tooth was engaged pretty tight under the second molar on both sides, as you can see. So I had to do a little bit more buccal bone removal to get down in there. And then I made my vertical section first. And then I went mesial distal on the crown, laying horizontal, took out this top part and then the lower part and then roots independently. And I did that on both sides. And it worked out well. It took a little longer than usual, but that was the approach I used. Some people will go in and you can just do a vertical section, pop out this coronal portion, and then remove the root tips independently. Sometimes you can be lucky and these things will come out in a horizontal fashion in one piece. This time I had to elect to section right here to take them out one at a time. But that's just a quick down and dirty on a case that I did this morning. Everything went well. Should expect a good outcome, and we should see him recover probably in about a week. He's going to be a little more swollen and tender than average, though.